Welcome back. Today, we're tackling a topic that affects so many: how hormones impact hair loss. Hair changes can be distressing, but understanding the root cause, often hormonal, is the first step to managing it. We'll break down the most common hormonal culprits: PCOS, thyroid disorders, menopause, and pregnancy. You'll learn what to look for, when to see a doctor, and what treatments are available. My goal is to empower you with clear, evidence-based information so you can take control of your hair health. Let's dive in. Let's start with PCOS, one of the most common hormonal causes of hair loss in women. PCOS is marked by higher than normal androgens, especially DHT, which triggers hair follicle miniaturization. This leads to female pattern hair loss, thinning at the crown and part, not a receding hairline. You might notice a wider part or a thinner ponytail. PCOS diagnosis is based on irregular periods, high androgens, and polycystic ovaries on ultrasound. Other signs include excess facial body hair and stubborn acne. If you have these symptoms, see a healthcare provider for hormone tests and an ultrasound. Treatment targets the hormonal imbalance. Birth control pills can regulate cycles and lower androgens. Spironolactone blocks DHT's effects on hair follicles. Topical minoxidil, Rogaine, can help stimulate hair growth. Consistency is key. Lifestyle changes matter. Healthy weight, regular exercise, and balanced diet can improve insulin resistance and hormone balance. Managing stress is also crucial, as high cortisol can worsen hormonal imbalances. In summary, PCOS hair loss is due to high androgens shrinking follicles, causing diffuse thinning. Diagnosis and treatment are multifaceted. Address hormones, use topical treatments, and focus on healthy habits. With a consistent approach, PCOS-related hair loss can be managed. Don't ignore other symptoms. Get a formal diagnosis for the best results. Remember, you're not alone, and there are effective options available. Stay patient. Hair regrowth takes time. Work closely with your healthcare team for a tailored plan. Consistency and a holistic approach are key to improvement. Let's move on to another major hormonal player: the thyroid. The thyroid gland, though small, has a huge impact on hair health. Both hypothyroidism, underactive, and hyperthyroidism, overactive, can cause diffuse hair shedding, known as telogen effluvium. Thyroid hormones regulate the hair growth cycle. Imbalances push more hairs into the shedding phase. With hypothyroidism, hair becomes dry, brittle, and thin, often with other symptoms like fatigue, weight gain, and dry skin. Hyperthyroidism causes fine, soft hair and increased shedding, along with symptoms like weight loss, anxiety, and rapid heartbeat. The hair loss is usually reversible once thyroid levels are corrected. Diagnosis is simple: a thyroid panel blood test. Treatment for hypothyroidism is hormone replacement. For hypothyroidism, it's medication, radioactive iodine, or sometimes surgery. Once treated, hair shedding should slow, but regrowth takes several months. Be patient. Hair cycles are slow, and improvement isn't immediate. If you notice diffuse shedding plus other thyroid symptoms, see your doctor for testing. Early diagnosis and treatment are key to reversing hair loss. Don't ignore persistent changes in your hair or health. Addressing thyroid issues can restore your hair and overall well-being. Remember, hair loss is often just one sign of a larger hormonal imbalance. Stay proactive about your health. Let's talk about another major hormonal shift: menopause. Understanding your body's signals is empowering. Take action early for the best results. Your hair can recover with the right treatment. Now, let's explore menopause and its effects on hair. Stay tuned. Menopause brings a dramatic drop in estrogen and progesterone, both of which help keep hair in the growth phase. As estrogen declines, androgens have a greater effect, leading to follicle miniaturization and female pattern hair loss. You'll notice gradual thinning at the crown, and a widening part. Hair becomes finer and less voluminous. This process often starts in perimenopause and progresses after menopause. Stress during this time can also trigger additional shedding. First-line treatment is topical minoxidil, which helps counteract follicle miniaturization and stimulate growth. Hormone replacement therapy, HRT, may help some women, but it's a complex decision. Discuss risks and benefits with your doctor. Anti-androgen medications like spironolactone can also slow thinning and promote regrowth. Gentle hair care is essential. Avoid harsh treatments, heat styling, and tight hairstyles. Nutrition matters. Ensure adequate protein, iron, zinc, and vitamins for healthy hair. Menopausal hair loss is common, but manageable with the right approach. Focus on scalp health and supportive habits. If you're concerned, consult your dermatologist or gynecologist for personalized advice. Remember, you're not alone. Many women experience this transition. Consistency with treatment and self-care is key. Be patient. Hair regrowth takes time. Support your body with a healthy lifestyle. Address both hormonal and lifestyle factors for best results. Stay positive. Improvement is possible. Let's move on to hair changes during and after pregnancy. Understanding the process helps you manage expectations. Next up, pregnancy and postpartum hair shedding. Pregnancy often brings thicker, fuller hair, thanks to high estrogen keeping more follicles in the growth phase. After childbirth, estrogen drops rapidly, triggering many hairs to enter the shedding phase at once. This is postpartum telogen effluvium. The shedding usually starts 3 to 4 months after delivery and can be dramatic, but it's normal and temporary. You're not going bald, just losing the extra hair retained during pregnancy. The shedding phase lasts about 3 to 6 months. Then your hair cycle returns to normal. New regrowth appears as short, fine, baby hairs along the hairline. There's no specific treatment. Be gentle with your hair, avoid tight styles, and use a wide tooth comb. Nutrition is crucial. Eat a balanced diet, rich in protein, iron, zinc, and vitamins. Continuing prenatal vitamins may help, but check with your doctor. If shedding is excessive or lasts over a year, see your doctor to rule out thyroid issues or iron deficiency. Postpartum hair loss is common and self-limiting. Patience and gentle care are your best tools. Focus on recovery and self-care during this period. Most women see their hair return to normal within a year. If you're worried, seek medical advice for reassurance. Remember, you're not alone. This happens to many new moms. Support from others can make a big difference. Take care of your body and mind during this transition. Your hair will recover with time. Let's briefly cover other hormonal causes of hair loss. Stay informed for a holistic approach. Beyond the big four, other hormonal imbalances can also cause hair loss. Adrenal disorders like Cushing's syndrome, high cortisol, or Addison's disease, low adrenal hormones, can lead to diffuse thinning or brittle hair. High androgen levels from conditions like congenital adrenal hyperplasia can mimic PCOS symptoms, hair loss, hirsutism, and acne. Elevated prolactin, hyperprolactinemia, can disrupt other hormones and trigger shedding. Chronic stress raises cortisol, which can shorten the hair growth phase and worsen shedding. Diagnosing these conditions requires specialized blood tests and sometimes imaging. Treatment focuses on correcting the underlying hormonal disorder. As hormone levels normalize, hair loss usually improves, though regrowth takes time. If common causes are ruled out, ask your doctor about less typical hormonal issues. A thorough medical history and targeted testing are essential. Don't ignore persistent or unexplained hair loss. Early intervention leads to better outcomes. Work with specialists for complex cases. Addressing the root cause is key to recovery. Let's wrap up with your next steps. Hormonal hair loss is complex, but manageable once you identify the cause. If you're experiencing hair loss plus other symptoms, like changes in your cycle, weight, or mood, See a healthcare provider. Dermatologists, endocrinologists, and gynecologists can help you get the right diagnosis and treatment. You're not alone. Many people face these challenges. Share your experiences or questions in the comments for community support. If you found this helpful,